Good afternoon. I'm Dr. Jazz Atwal. I'm the Acting Deputy Chief Provincial Public Health Officer. Today we are announcing 2 additional deaths related to COVID-19. One from Southern Health, Centre-Sud, and one from the Winnipeg Health Region. I want to extend my condolences to all the families, friends, caregivers, and individuals announced today. The current 5-day COVID-19 test positivity rate is 9.3% provincially and 6.2% in Winnipeg. As of 9:30 a.m. today, 173 new cases of the virus have been identified in Manitoba. The total number of lab-confirmed cases in Manitoba is 28,260. All Manitoba teachers, educational support staff, and other staff working in schools and directly with students will soon be able to access an appointment for COVID-19 testing at the FastPass site at 1066 Nairn Avenue in Winnipeg. Appointments for the pilot site will be open to eligible staff working in all schools and school divisions effective January 23. Eligible clients must be symptomatic, identified as a close contact as a result of an exposure at school, or have a symptomatic household member. Clients will be required to show identification and proof of employer at the time of appointment. FastPass appointments must be made ahead of time by phoning the province's central COVID testing appointment line, which will triage eligible clients to the FastPass site. Text messages are also being used to support case and contact monitoring on a daily basis, in addition to phone calls from contact tracers and automated phone messages. Text messages for monitoring is being used in combination with support from members of the Manitoba government's contact tracing team throughout their isolation period. Responding to these text messages is needed. If you received a text message but prefer a phone call instead, you must first respond to that text message. But then you can request any further follow-up to be done via phone call. Text messages are being provided as an additional service to augment the contact tracing team's overall capacity and provides another option for cases and contacts to interact with public health officials. It's important that the public respond to these text messages as soon as possible to improve the speed and accuracy of our efforts to stop the spread of COVID-19 and to protect all Manitobans. On Thursday, modest public health changes were announced. The entire province will remain at level red on the Restart Manitoba pandemic response system. The current orders expire at midnight tonight, and the new set of orders go into effect first thing Saturday morning. The new orders will apply to the Winnipeg, Southern Health, Centre-Sud, Interlake Eastern, and Prairie Mountain Health regions. However, the current case counts and test positivity rate in northern Manitoba and many First Nations communities remains high. Changes will not apply to that region or to the community of Churchill, and current restrictions will remain in place. As indicated Thursday, the changes will include expanding the orders to allow increased personal connections and support for the well-being of Manitobans. Orders indicate that 2 designated people, family or friends, will be allowed to visit a household, outdoor visits of up to 5 people only, plus members of a household on outdoor private property, and funerals can have up to 10 people in addition to the efficient under clear COVID-19 protection protocols. For retail operations, the orders will be expanded to eliminate the essential items list. Stores can sell all products if they maintain physical distance between customers and follow occupancy limits of 25% or a maximum of 250 people, whichever is lower. Non-regulated health services are allowed to operate with requirements to collect information for contact tracing purposes. Barbershops and hairstylists can reopen at 25% capacity with adequate physical distancing and requirements to collect information for contact tracing purposes as well. Our collective progress in reducing the spread of COVID-19 means we can undertake these careful, measured openings. This is going to be a gradual and cautious process. We can't open everything all at once. We will not be successful if we do that. It remains crucial that we continue to follow the orders currently in place and the fundamentals as we move forward through the pandemic. Stay home when you are sick. Wear a mask, wash your hands, cough into your elbow, stay home and self-isolate if you're awaiting test results. If one person in a household is waiting for test results, the entire household needs to self-isolate. We have to keep focusing on the fundamentals to protect ourselves, our loved ones, our neighbors, and our coworkers. We need to continue to make these sacrifices in the short term so that we can be safe in the long term. I can now open it up to questions.
Thank you. We'll start today with Taylor from CHVN.
Hi, good afternoon. A lot of parents have voiced that they want their kids back in organized sports. What will it take for that to happen?
Question. I think what we're doing here is we're not going to speculate about the future. I mean, we're just about to open up people's actions a little bit, opening up those barber shops, opening up non-essential retail. I think we're going to have to see what happens with that opening. We're going to have to look at our acute care capacity during that time. We're going to have to look at our case and counts and our contacts, the number of individuals, and we're going to have to see where that goes before we look at any other sector or any other area and consider loosening any more restrictions in the future. So at this point, really don't have a definition related to that. It all depends on what happens over the next few weeks' time, and then we'll have to reassess the situation.
From a public health perspective, how do you weigh those pros and cons?
Well, I mean, there's the obviously we put a lot of measures in to protect that acute care system. We put measures in to ensure that the acute care system didn't get overwhelmed. And obviously we saw that once we loosened restrictions, later in the fall, early winter time, those case counts, those hospitalizations increased. As we look at the orders, we're loosening things up a little bit. We're going to take a graduated step here and reassess things. We look at risk when we're looking at changing orders. We also look at public need and desire as well. Also mental health, physical health, emotional supports. There's a number of things that we look at in relation to the orders to determine what we should do next and what is safe to do as well.
Manitobans rely on gyms and sports to stay physically healthy and mentally healthy. What are some of the effects from these long closures and pauses are you seeing right now when it comes to sports and gyms and anticipating seeing in the future?
Yeah, great question. Sports is important. Gyms are important as well. Physical activity is important. Mental health is important. There's plenty of opportunity to exercise and partake in activities outdoors. So there is that opportunity there. People can go running outside. They can go for a walk. They can go skating at the present time, tobogganing. So there are opportunities to look at doing those sporting activities, which obviously is really good for someone's mental health and physical health. So, we do take those things into account. We do understand that the restrictions have an impact on mental health, but we also have to balance that against what happens with a lot of infection spreading. The acute care system being taxed, vulnerable patients dying. So we do have to look at everything together and not just one area or one sector.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Can you provide an update on the asymptomatic surveillance pilot in long-term care homes? How effective was it, and are we going to see a broad rollout?
Yeah, great question. I don't have the information on that in detail at the present time. I know the pilot occurred in 3 nursing homes. There was a number of tests done. I think the information is being analyzed right now, and I think a report will be coming out shortly on that. I just don't have the details of that at this point.
Okay, thanks. Last we heard in Manitoba, I think we had about 30 rapid test units deployed in northern and rural communities. Is the province planning to send more of these rapid tests, I guess, for regular use in First Nation and remote communities? And will the antigen tests ever be sent to those same communities?
Great question. So we have a lot of tools that we're using on the testing front. We have our gold standard, CPL, PCR-based testing. We have a lot of rapid tests. A lot of those rapid tests also require a secondary confirmatory test as well. So they are being deployed. We have a number of them out there throughout the province, including the city. And we're using them to quickly identify cases, to be able to case and contact management to prevent spread in vulnerable populations or vulnerable communities. So there is ongoing work on the devices that we have, that we've operationalized, and also some newer technologies that might be out there as well. So as time goes on, we'll have more information what else will be accessible. So it's one thing having a device. The other thing is having the cartridges for those devices to be able to use the devices as well. So again, there are some rate limiting steps here that we are working through, but we are definitely looking at improving our ability to test more.
Thanks. And I guess my last question today is on some of the variants of COVID-19 that we're seeing across the globe. So can you explain the process for monitoring for those variants in Manitoba? And what is the protocol? What happens if such a variant is found in the province?
Yeah, great question. So we've had a number of different variants that have hit the media, right? There's variants around the world. We've seen the UK variant here in Canada. So we have had a number of cases of that in different provinces. At this point, we haven't seen that variant or a variant like that in Manitoba. So since the beginning of the pandemic, anytime there has been cases identified or lab-confirmed COVID cases, at random during the early processes, those swabs would also be sent to a national lab where genomic sequencing is done. So this isn't something that is just starting now. We have been doing this all along. We're continuing to do that as well. This just doesn't happen for Manitoba, it happens in all the provinces as well. So we have looked at targeting specific samples to send for that. So we are focused on those returning travelers, international travelers. We also look at outbreak situations and select a few samples from outbreak or cluster investigations to send to genomic sequencing as well. And then there are some samples that are sent at random.
From Global, Marnie.
Hi. We're hearing a lot of confusion about the two-person rule, so we just wanted from our viewers, so we just wanted to get some of those questions to you. If there's a household of, say, 4 people, and, say, grandparents come visit that household, can that household then go visit those 2 grandparents in their home?
Yeah, so when we're looking at the spirit of the order here, the orders is 2 peoples that are designated that could enter a home, and vice versa. If those 2 people have, they can't have a family back over at their house, it has to be the 2 people, right? We have to look at the spirit of the order. I think everyone gets the intent of the order. There's a lot of questions out there. I think some of the questions are related to how to almost skirt the order. The principle here is 2 people, they're designated, it's the same 2 people, period. I think it's very clear, and I think Manitobans in general understand the spirit of it.
Thank you. And just following up on that, what about how do 2 people with young children or babies, how does that factor in?
So I'll clarify your question. If you're asking me, can 2 people and 2 babies go to someone else's house and be the designated 2 because there's 2 adults, I believe is what you're asking. And realistically, that goes against the order and the spirit. We want to limit interactions. So if it's a parent and 1 child that goes visits, let's say grandparents, and they're the designated people, that's okay. That is the spirit of the order. Hence, those grandparents can visit the 2 parents and those 2 kids in the family of 4 home, right? In the home with the 2 parents and the 2 kids as well. Again, that is the spirit of the order. We would like that bubble concept. We want the same people interacting. We don't want a number of different households interacting. We don't want 2 people going to 10 different homes on a regular basis. Keep it simple. This is important. We all need to do this. I need to do it. It's incumbent upon all of us to do this. We want to protect Manitobans. We want to keep our case counts down. We want to limit interactions. We need to limit interactions. And that's what it comes down to. That's the basic principle to prevent the spread of this virus, is limit those interactions.
Thank you. And on another topic, will the AHL or the Manitoba Moose be approved to play in Winnipeg with the same strict guidelines the Jets are taking?
Don't have a line of sight on that right now. I know there's been some work being done on that. I just don't have an answer for that at this point.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Atwal. Today I'm asking questions from readers. So the first one is, can counselors reopen? Those who are not a part of a governing body and who had to close to in-person clients. Please know I can do video or phone sessions, but most people will not do it and are waiting. Mental health should not have to wait.
Sorry, can you just repeat the first part of that question?
So this reader is a counselor who had to close and who is not part of a governing body and is finding that their clients are not really taking to video or phone sessions. She wants to know, as part of the loosening, is she allowed? Is that possible?
Well, we've opened up regulated health professionals and other health professionals, so I can't comment specifically on this counselor. People do have access to the ability for healthcare. We encourage people to do that. Mental health is important. Connecting via phone or virtually is really important as well. Unless you have to visit someone, even for healthcare reasons in person, you should try to avoid that. But it is still important if you have to do it. A lot of physicians do a lot of work. A lot of nurses do a lot of work via phone and connect with clients as well, and as do psychologists and psychiatrists. Without knowing more details, I think as if they fall into the category of one of the individuals who are allowed to work, they should be able to see clients as well.
Okay, thanks. Next question. What is the availability of the Moderna vaccine as the Pfizer vaccine is being cut back? And a few people have asked, are the two interchangeable? Can you get the first dose from one company and the second from another?
Yeah, so, great question. At the present time, we aren't aware of any supply disruptions on the Moderna side. We have a known amount that we're getting at regular intervals. I don't have those numbers in front of me. I'm sorry. I believe that's on the dashboard.
Okay, thanks. And finally, can you describe what treatment in hospital for COVID-19 patients actually entails?
I could provide a little bit. I'm not an intensivist. I don't work in an acute care setting. I do work and see patients, but not in an acute care setting environment. The mainstay of treatment is supportive care. So you're looking at, if someone is admitted to the hospital, if you're in a hospital bed, you could imagine someone getting oxygen, maybe some IV fluids. They do provide some other medications like dexamethasone, which is a steroid. Sometimes there's puffers involved, like the same puffers we use for asthma or COPD. Obviously, if you're in an intensive care unit, that means you need a greater level of care. So typically, most patients who require intensive care unit work, they'll be on a ventilator. So basically there's a tube in your throat to help you breathe. And sometimes there's special medication given to keep your heart pumping to make sure your blood pressure stays up. On top of that, there's probably a couple other treatment modalities as well, but I just don't have the details of that.
From CJOB, Malika.
Hi, Dr. Atwal. Okay, so it's going to circle back to one of our viewer questions. Marnie had asked something along the lines about bubbles and visiting grandparents. So we understand that if a family of four, you'd explained, has 2 adults and 2 kids, and they want to go visit grandparents, they can't, not all 4 of them. However, those 2 grandparents can visit the family of 4. Now, if we're thinking about that with the bubble, we're just trying to help our viewers and ourselves understand that doesn't really make sense, because if the grandparents are in the family of 4 bubble, then why could the family of 4 bubble not go see the grandparents if that's all they're seeing?
It's the way orders are written. There's some. It's hard to write words to correlate what we want to create in a safe way. It's easy to kind of say it's 2. And you leave it at 2. We understand, we recognize that there will be times where 2 people will visit 4, and out of those 4 people, only 2 of those could visit 2, but it keeps it simple, which is what we want. We don't want confusion with the orders. We want to, again, limit those interactions. And again, the spirit of the order is to kind of create that bubble. It's hard to define that bubble, and it's hard to enforce that as well. So I think we need to keep that in mind. All right. So we want to keep this simple. So it is 2, and we understand the point that readers are making or viewers are making. But I think in general the public understands that. We have to give people credit for all the work that they've done, and they continue to understand that we need to mitigate risk. And again, I think people understand the orders and the spirit of the orders as well.
Wonderful. Thank you so much. And another kind of connection to this question, if you're a family of 4, 2 people in your household be another person's bubble, and then 2 people be in another group's bubble, like another, going to visit someone else. And I understand the concept of bubbles, but just, help clarify that as well.
Sure. Again, we want to have that limited to if you're someone's bubble, we want them to be a part of your bubble, and that's it. So, an example, I have a brother, I have a mom, or my in-laws, I say there's 2 of them. If they're a part of our bubble, then we should be a part of their bubble, and that's it. So I know there's my in-laws, they have 3 kids. Can all 3 kids technically be in their bubble according to the order? If they go separately, yes, in groups of 2, let's say, with their husbands but from a spirit perspective, we just want it to be 2 people. So I know it's going to cause issues. I know, parents want to see all their kids. I know, people want to see brothers or sisters and have that relationship there. Continue to focus on the online measures to do that, video conferencing, connections with FaceTime or technology using a phone. But really from a bubble perspective, the same 2 people you allow in your home, we would want the same 2 people to be allowed into the other person's home. From a spirit perspective, that is what our desire is.
Okay, wonderful. Thank you. And then this is another topic. So hair salons are allowed to start, services again starting tomorrow, but services that are potentially in hair salons or like that with waxing or hair removal, that's still prohibited. So our viewers wanted an explanation to give those business owners who are watching hair stylists reopen this weekend, may have to wait a couple of weeks themselves to reopen.
Yeah, it really comes down to we just can't open up everything at once. And we understand that there's disappointment out there. We have to carefully select the things that we do want to open up, that society wants to open up as well. So we're looking at barbershops and hair salons. We're just thinking about haircuts on the scalp, right? Hair on your head. We're not looking at waxing. We aren't looking at nails. That involves more interactions. Again, this virus comes down to those interactions. The more people are out, the more that you do with others, the greater the risk. That one moment where you're doing something with someone might not be that risky. We have 1.4 million people in Manitoba. Multiply that by 1.4 million, right? Multiply that every single day, and it becomes an exponential type of risk that occur. And that's what happened to us in the fall. If we had all those restrictions in place, we had guidelines in place for all the businesses, and we still saw our case numbers rise. So we need to understand that. And again, we are looking at the orders on a regular basis as well. So for this interim, for the next 3 weeks, this is where we've drawn the line. And we're going to take another look at it, obviously, in 3 weeks' time, depending on all those other indicators we keep talking about. Acute care capacity, testing, case and contact management, test positivity, total number of cases, different settings where virus is spreading as well.
From the Winnipeg Sun, Josh.
Good afternoon, Doctor. We got the press release earlier this morning about the number of vaccines being reduced in Manitoba again to 2 trays starting February 1. This means Manitoba has now lost about 90% of the doses we were promised. How will this play into the future lifting of restrictions, considering so much optimism of a recovery and being able to lift some of these restrictions was tied to the vaccine rollout?
Great question. I think when the vaccines came on the forefront here, when we started looking at a vaccine program for COVID-19, when we started inoculating people, I made a statement that this isn't a 100-meter sprint. It's a marathon. And I think we need to understand that, right? This is a really big jigsaw puzzle, and we're just at the beginning of putting some pieces together. So a delay of a few thousand doses in the grand scheme of things really has no impact. It really has no impact on what we're going to be doing from a public health perspective in relation to risk. We're still going to look at cases. We're going to look at test positivity, capacity issues in acute care. We're going to look at all that. It's disappointing. Don't get me wrong, it's disappointing. It was sort of unexpected. We developed the vaccine program to anticipate these issues, and we're proud to say we're not canceling appointments, right? We haven't canceled appointment. If you had an appointment, your appointment's guaranteed. In other jurisdictions, they've had to do the opposite. We're running a safe vaccine program, and short term, yes, there's going to be these bumps. Long term, it looks very promising. In short term, we have Moderna, we have Pfizer, we have some supply issues in Pfizer that should be stabilized via the manufacturer in the next few weeks. Thereafterwards, there's a few other vaccines potentially on the horizon. They aren't approved yet, but they show a lot of promise, and they will allow us to scale up really, really fast. So again, we're at the very early stages of a vaccine program. Again, people need to think about this as a marathon. There aren't any quick fixes in a pandemic. So I understand some of the disappointment, but the outlook is good, but it's not a short-term outlook. It's going to take months.
And looking at those appointments, you're stopping booking for appointments in Brandon and Winnipeg at the super sites there. Yet we're proceeding with opening up the super site in Thompson on February 1. With bookings starting on January 25. How many available appointments are there for that Thompson super site starting on January 25? Was there any consideration to delaying its opening, considering the supply challenges for the vaccine right now?
Yeah, so it's changed our plans a little bit. I don't have the exact number of appointments that will be available in Thompson. The super sites in Winnipeg and Brandon, those were Pfizer super sites. Were predominantly, all we were doing was giving Pfizer through those two sites. The plan was to look at Pfizer at the Thompson site as well. We've pivoted a little bit, so we're going to be using the Moderna vaccine in Thompson. And at this point, I just don't know the volume of individuals we'll be able to accept, but those appointments will start booking on Monday, and the Thompson site will look at Moderna vaccines. Any detailed questions related to that, I think we'll have to get some information from the vaccine task force. They'll have a lot more detail to this than I do right now.
Okay, and just looking at the cases in Winnipeg, the new cases continue to slowly drop now to 56 or 58 today. Where are these cases being driven from in Winnipeg at this point? Where are you seeing the bulk of these new cases coming from? And before you're talking, or it was being discussed, they're coming from the homeless populations and outbreaks in personal care homes. Is this still where they're coming from? And how does that impact the general population when we're looking at easing restrictions for other businesses further in the future?
Yeah, so I don't have the complete details on every single case for the past few days in Winnipeg. They are low numbers. We're 50, 56 today. I believe yesterday was close to 50 as well. A lot of those cases are in certain areas where there is homeless populations, where there is poverty. There's businesses there as well. So everything does play a role in our decisions, right? Just because homeless people, let's say, aren't impacted by COVID at the present time, all those other people were impacted by COVID in the past. This is a virus, again, that's easily transmissible. It's about those interactions. And the orders are about limiting interactions, right? We need to limit those interactions wherever they occur to be able to manage the hospitalizations and that come out of a number of infections. So again, we look at all those things. We have specific things we're doing with certain populations to target to ensure that case and contact investigations are occurring faster, that testing is happening faster as well, and more is being planned for that as well. But don't think that this is a virus that likes poverty. We've seen this before. Right now it's in poverty, but it wasn't in poverty a couple months ago, right? So we do need to take that into account.
From CBC Radio Canada, Gavin.
Hi there, Dr. Atwal. Just looking at today's number, there's 33 cases in Eastern Interlake. I was just wondering where these come from, if you have any idea if there's an outbreak or something like that.
Yeah, sorry. I know the number's 33 for today. I just don't know if it's related to anything specific. We'll have that information likely in a few days.
Okay. What advice do you have when your two designated people come to your house? Is it business as usual before the pandemic, handshakes, hugs, and that sort of thing, or should certain precautions be taken?
The same precaution should be taken. Just because someone is coming to your home doesn't mean you should be hugging them or kissing them, right? I think we need to understand, again, that's risk. We understand that having two people over increases risk. We've talked about that before, but we also understand people need that physical connection as well. It's good to visit people. Distance. You still need to distance. Wear that mask. Wash your hands when you come into the house. Use alcohol sanitizer in the home as well. It's still important to look at those non-pharmaceutical interventions, those things that we talk about every single day from a public health perspective. By allowing this, we're going to see how Manitobans are doing. Again, it's incumbent upon us to interact in a manner where we're not transmitting the virus. Again, people might think the risk is low because this is my bubble. But again, you're interacting with someone. There's risk there. There's no zero risk situation. And if we put multiples on that, again, it's not just you and your neighbor or you and your parents. It's everyone has a neighbor. Everyone has a parent. Everyone has a brother, right? So it's families that need to worry about this. We don't want our case counts to go up. We want to try to be able to open up more of society, but that's all going to be based upon what Manitobans do and how they interact and how they behave.
Thank you. And finally, just a clarification about the vaccine bulletin. I don't know if you can help me with this. But it reads, by the end of the week, teams will have visited 61 personal care homes with an estimated 3,903 residents. An estimated 90% of residents have been immunized. What does the 90% refer to? 90% of the, immunizations projected for the week have been done. 90% of residents per care home. What does that mean?
I'm not exactly 100% sure what that means. When I read it, I would anticipate that if 100 people in a care home were offered vaccine, or if there's 100 people in the home, personal care home, 90 of them got the vaccine, and the other 10 either had a medical issue or an allergy where they couldn't get the vaccine. So that's the way I would look at that percentage, but I think we'd have to get some clarity on that and provide that back to you as well.
From CBC Manitoba, Bart.
Hi, Dr. Atwal. Are any second doses canceled or in jeopardy because of this new Pfizer reduction announced today?
Yeah, I think the vaccine task force is looking at that right now. To the best of my knowledge, as of this morning, nothing had been canceled. So if you had an appointment, that appointment is still there.
All right, then, thanks. What concerns do you have about overcrowding either indoors or in lineups entering tomorrow when shopping resumed at big box stores, shopping centers, and other busy shopping nodes, the big ones?
Well, there are occupancy limits of 25% or 250 people within a store. Shopping malls will have an occupancy limit of 25%, and they have to verify that. They have to put some sort of check and balance system in place. Enforcement will be out. When we're looking at, retail shopping, it is low risk. People are typically just going in. They're not interacting with a lot of individuals. They're grabbing something and leaving. So there is some risk there. Again, we're not saying it's zero risk. So again, it'll be about the behaviors of Manitobans. It'll be about the behaviors of these businesses as well. And again, enforcement will be out.
When we look up north, we continue to see disproportionate case numbers. They're having an average of, per their population, they're like having about 100 cases per 100,000 people. There's only about 100,000 people there. I know there's rapid response teams. I know First Nations Health is heavily involved. I know the feds are in Island Lake. But what additional things can the province do now to address this, seeing that this continues to be concerning and continues to affect people who are really among the most vulnerable people in the province?
Yeah, so, we're doing a lot of work. So public health is involved in every single community that has cases within the north or anywhere in Manitoba. We're working with First Nations Inuit Health Branch. So Manitoba Public Health is working with First Nations Inuit Health Branch. We have physicians involved. We have public health nursing involved with deployments or virtual help. Obviously, the Canadian Armed Forces is in one community right now. We have these rapid response teams going into outbreak communities. There's a lot of infections happening in different areas. A lot of specific things have been done with homeless populations in Thompson, let's say, specifically. A lot of work has been done with the leaders in Lynn Lake. And again, we have these case numbers there. They are trending up. We're not denying that. In general, for most of the communities with cases, things are settling. We are worried about a couple of communities, though, and I mean, there is effort there through the province, through federal partners as well, along with what's called tribal councils, where certain communities, let's say First Nations communities, have tribal councils where they get together and they provide services for more than one community. So they're involved. We have local community supports as well. So a lot of work is being done. In Thompson specifically, a lot of work was done with public health, again, with those targeted populations where infection was happening. So business leaders got together, public health got together, some First Nations communities got together to help support that as well. So again, it's an all-out effort. I think there's a number of different stakeholders there, and they have done a good job with previous outbreaks, and they're going to continue to do that great job that they're doing. And obviously there are some structural reasons why certain communities have a higher number of cases or the risk is higher in those communities. But we feel that we are getting in the right direction in relation to the cases within a lot of those communities.
From the Canadian Press, Steve.
Dr. Atwal, given that the demand on ICU beds is down, but it seems to be sort of plateauing, it's not dropping very sharply, and given the rising cases in the north and remote communities where people might be more susceptible to severe outcomes, where do you see the demand on ICU beds going over the next 3, 4, 5 weeks, given the spike we've had in the north?
Yeah, so great question. We know obviously some of these cases have generated ICU stays. There's been people in and out of ICU already, since some of the activity has increased in the north. Again, it's hard to predict 4 weeks down the road with this virus, right? We have to see what's happening in a community. We have to see if we're able to contain it. If we are able to contain it and keep the numbers low or manageable, I think that'll look good for our acute care system to be able to manage. So we kind of look at this every day. We kind of look at trends as well. Some of the benefits in some ways are not a benefit, but it's a younger population up north, right? So yes, there's a lot of cases being generated up there. There's a lot of recoveries as well, and this virus is less impactful to those who are really young, and we're seeing a lot of really young cases there. But we also have a large vulnerable population that we are focused on. So again, as time goes on, I think we'll have a better idea where this leads to from an acute care impact.
Do you have a forecast as to where in the next couple of weeks you might see ICU bed demand going? It's, just over 100 last time we checked, including people not with COVID, like total demand. Where do you see it going?
I don't have a numerical projection. The cases in the north are going up. The cases everywhere else are typically going down. We are, again, opening up interactions with individuals, so that'll have an impact on case counts, we believe. And it's anticipated, we're going to generate cases, and with that, we're going to generate hospitalizations. Again, for every person coming into an ICU, there's another person leaving an ICU as well. So it all just depends on a bunch of variables in relation to capacity issues. So I don't have a numerical answer for you right now, sorry.
Okay, and final question is about, you've heard it today, a lot of readers, a lot of people out there are looking for angles, looking for perhaps some clarity on the two-person visit to household. You've been very clear that it's 2 people going into a household. But did the province look at the successful example of the 2-household bubble concept that was used in Atlantic Canada back last spring? That seemed to be very clear. It was widely accepted, easily understood, and the governments in Atlantic Canada said, okay, well, you can designate one household, those 2 households interact, and nobody else.
Yeah, back to the spring, I don't know if other interventions were done in Atlantic Canada. I think Atlantic Canada had created their own Atlantic Canada bubble as well, right? So it's hard to compare sometimes 2 provinces even, or 2 countries, or 2 different settings in relation to prevention. So different things work in different areas. And obviously, just because something worked one place doesn't mean it's going to work someplace else, for a number of different reasons, from the amount of virus circulating, underlying within a community or a setting, test positivity as well, and the interactions, the ability for, smaller households, let's say in a home. I don't know what the average number of people are in a home in Nova Scotia, and is that different in Manitoba? So all those things play a role in risk. And, we have to look at Manitoba's risk. We're looking at Manitoba solutions, right, for Manitobans. And that's what we're trending toward. That's what we're doing. And that's what we're going to continue to do.
From CTV, Jeff.
Hi, Dr. Atwal. I'm just wondering, if Manitobans need physical proof of vaccination, how do they get that?
Yeah, at the present time, we aren't providing a physical proof of vaccination. We could print off a document that has an immunization history. This is something we're working on through public health, and we're working nationally as well on this as well. So we're at the infancy of this, and I don't have a clear-cut answer for that at this point. So we are working again nationally with other provinces and other public health units, and also with the the federal Public Health Agency of Canada. And with time, I think we'll have some better answers for that.
So is the idea here, are you looking at some sort of vaccination proof card?
Not here to speculate. Again, we're going to work with our partners to see what is the best solution. Is it a provincial solution? Is it a federal solution? We're at the very early stages of that. We don't know where this is going to land.
Okay, and we're getting questions from some home hairdressers, hairstylists who work out of their home. Their business is operated out of their home. Can they reopen tomorrow?
If they're a registered hairstylist, that's a barber or a hair salon, then they could provide that specific service.
From City News, Jonas.
Good afternoon, Dr. Atwal. Just some clarification on the rollout of the vaccine program for those in personal care homes. Has there been any delay to your knowledge? It is still proceeding as expected, given the delays in the Pfizer delivery.
So yeah, the delay in the Pfizer shipment, we made sure that there would be no delay in the PCH side of things. So there should be no delay in relation to vaccinating residents in PCHs.
And a clarification on that 90% number. So this would be 90% of all eligible personal care home residents have now received their first dose. Is that accurate? Is that what we should take from this?
For the care homes where the vaccine was provided already, right? So there's going to be other care homes having vaccine next week. So up to this point, I believe it's 90% for the care homes where the vaccine was provided.
Thank you for that. And just as a final follow-up, it's going to be a big weekend. We're going to get stores reopening. We're going to have a lot of Manitobans out again. Maybe just a general message to folks as we head into this weekend, if you could just say maybe one or two things they really need to focus on to ensure that, this is successful.
Right. So, I know a lot of people have been, struggling with restrictions for 10 weeks' time. We're in a really restrictive state. This is our first step at a gradual reopening. And it's going to be up to every single Manitoban to do those correct things, right? This isn't about trying to skirt an order, to try to find a loophole in something. I think everyone understands what they need to do. People need to focus on that. People need to focus on ensuring they limit those interactions with people. If you have someone over, make sure they're 6 feet away. Have a mask on. If you're at a store, don't be shaking hands with people. Go in, get what you need, send one person still, and leave. This isn't about increasing risk so substantially that we have to lock down again. We don't want that to happen. I don't think Manitobans want that to happen. Again, I think Manitobans understand what's at stake here. And they need to do those fundamental things to make sure that we're able to move forward and move ahead of where we're at, and make sure that we continue to look at opening things up.
Thank you, Doctor. This concludes today's media briefing.